Hello, I'm Christopher Buckle. I'm a consultant hip and knee surgeon here at the Horder Centre. The first key to helping you with your knee pain is to understand the underlying cause for this. Here at the Horder Centre we've got an expert team of physiotherapists and surgeons who will be able to help you do this. This will be through both physical examination, history about your condition and further imaging such as x-rays and MRIs. Once we understand what the cause of your knee pain, there are a variety of treatments that are available to you. These can include the use of medications such as tablets or topical creams, the use of injections into the joint. Beyond medical treatments of your joint pain, physical therapy plays an essential role in the management of your pain. This can be in the form of exercise-based treatments, in addition to lifestyle modifications. Ultimately, surgery may be indicated to help manage your joint pain, and this can include options such as minimally invasive keyhole operations, joint preservation surgeries, and potentially joint replacement operations. For the management of knee arthritis, the surgical options can include both partial and total knee replacement. Your knee is composed of several different areas. These can involve the inner aspect of the joint, the outer aspect of the joint, and the kneecap. It may be that you have only worn out a small portion of your knee and it is possible to just replace this part of the knee, or it may be that you require a total knee replacement where all of the joint is replaced. There are potential risks and benefits of both these operations. Some of the benefits of partial joint replacement are that it is a slightly smaller operation, there is a slightly faster recovery, and potentially improved function in the longer term. There are lower risks associated with the anaesthetic and some of the surgical complications. Total knee replacement is an excellent option, offering very similar benefits, but with a lower risk of the requirement for redo operations in the longer term. It is important you talk with your surgeon to discuss the options and your suitability for these two types of operations. Patients frequently ask how long will their knee replacement last. We have a very good understanding of this today, in part thanks to some of the data that is collected at the time of your operation. All patients undergoing joint replacement surgery at the Horder Centre and throughout the country submit data to the National Joint Registry. This provides us with an accurate understanding of the performance of joint replacements in the longer term. This also happens in several other countries around the world, and today we are able to have an extremely good understanding of how long a joint replacement lasts. It is reassuring to understand that 25 years after a knee replacement, 8 out of 10 patients still have their original knee replacement in place.